We look at the ovarian factors. Now we're at, this is the vast majority of the infertility problems, is the lack of ovulation. And the primary causes are lack of a normal cycle, so lack of menstruation, or an abnormal cycle, dysmenorrhea. And this is caused by dysfunction of the endocrine system and polycystic ovaries. So this is really your number one cause, the polycystic ovaries. And the treatment there is the Clomid and metformin, and I'm sure you know the significance of that. It's very aggressive, and we can treat these things naturally. In fact, on my website I have a testimonial of a patient who, on follow-up, and we weren't treating her for fertility, but just general health, and this polycystic ovaries was one of her complaints, and she went in for her annual checkup, and they're like, where's your cysts? Where we can't find any. And we primarily treated her immune system, her pancreas, and her adrenals. So that resolved the issue. There was no surgical process. Dysfunction of the endocrine system, the way they look at the endocrine system is basically this. They look at your TSH, which is a pituitary tumor, or a pituitary hormone, and if it's high, they give you levothyroxine, Synthroid. And then they rule out pituitary or adrenal tumors, like if you have super high cortisol or super high pituitary hormones, and then you'd be in a surgical situation. But these are like one half of 1%. And most of these dysfunctions of the endocrine system are functional, and they can be corrected. In fact, we can correct the high TSH also. We can look at your whole endocrine system and work on those problems. And I can't tell you the number of people who have come to me and said, wow, I started having my period, and it just was normal. Like there was no pain and dysfunction associated with it. It just started to happen naturally and normally and comfortably and easily, the way it's intended. So these are really the vast majority, and really functional problems. So these problems should be treated with functional endocrinology.